respected doctors and the guests and the speakers who have come all the way throughout India, and the doctors of Andhra Pradesh who have travelled overnight to attend this CME program. And it is a great pleasure to welcome you all for this event, because this is a unique program where it is not a common disease. The disease itself is a single diseases which are causing havoc to their families and a genetic disorder. So hemophilia and hemoglobinopathies are specific disorders where they require a lot of attention. It is not properly, not to say properly, in the medical curriculum, not much importance is given because this is a rare disease, but the sufferings are very tragic. And average hemophilic, if not treated in 80s, their lifespan is only 25-30 years. By the time they reach 15 years, most of them used to end up with disabilities worse than a polio. Like that, hemoglobinopathies also, thalassemia patients, they also suffer. Every week, every 15 days or 20 days, they require a blood transfusion and the other medications because of the serum ferritin levels in the body, which affects all the parts of the body, including brain, liver, kidney, everything. So this is the problematic diseases. Fortunately, we are working for the last 40 years for these disorders since 80s. We have organized in 90s into a specific social NGOs, societies. So in these things, when there are people in 80s, there is almost no treatment, only plasma for a hemophilia patients and a whole blood for the thalassemia and other hemoglobinopathies. With the formation of the societies, there is a lot of improvement. Since 90s, we started working. Since 1993, we organized. Even in those days, in 90s, there are only hardly 50 to 100 people recognized all over India. When Hemophilia Federation was started, 1984, even in 90s, there are not more than 50 to 70 patients. So like that, now, even though expected population is 1,25,000 of hemophilics and almost 2 lakhs of thalassemics, till now, Hemophilia Federation is able to locate nearly 29,000 bleeding disorder patients. So this is but it is the second largest number in the world where there is recognized. That is the uniqueness of India, where we could locate. But the management in 90s, we used to depend plasma, and there is a havoc of HIV. Later, heat-treated products. Later, solvent detergent method, the plasma is purified. Later, monoclonal. By 2000s, recombinant factors have come. The change has started occurring even in India for the last 10 years. The government is supporting, and that made a lot of change. When we started the Hemophilia Society, there are hardly 7 or 8 people. Now we have more than 1,100 hemophilics in a Hemophilia Society Vijayawada Chapter. I am proud to say nearly 200 of them have come up in their life. Just awareness and education has brought this change. And about 10 to 15 people are earning in software or other more than 2 lakhs a month. That was the achievement we could do with the formation of a society. The simple education, awareness, and a little bit of factor support. So this is the way we have brought up. Even thalassemics, the latest trend is giving a RBC only, that too leukodepleted RBC. So that makes a lot of difference. Even Andhra Pradesh as government has supported for the last 5 years through NHM all the blood products and for the management of thalassemia and sickle cell disease. So this is the achievement over the period of these 35 years of the formation of the non-governmental NGOs with the social work. So I welcome you all. So my basic request to all is, with the namaskarams to all the government doctors, we have to do a lot of things to give a care. If provided care, they can live like any other normal individual, they can lead a normal life. That's what we could achieve. Even few days back, a platelet disorder patient, Glanzmann's thrombocythemia, where we could operate at government hospital with the suggestions from the society. They did a wonderful job of saving the life of a acute peritoneal bleed due to rupture of ovarian cyst. So in spite of all these things, with the government support, we are able to reach these goals, and the government has spent about more than nearly 2 crores of rupees for the medication for that patient. Last month only we could do it. So like that, the formation of the society and coordination with the government, we are able to do a lot. So this is main program to all the doctors in the district, makes a change in their life. We all with you, and please help the patients, all these suffering people, to get a better life, because they lead a normal life like any other individual. They become a productive members of the society. Thank you very much for giving me this opportunity.